Hello, everybody. This is the restraint skill demonstration video, and this is by Ava, Brandi, and Carly. To begin, the overview of this video will include what restraints are and the different types that can be used in the healthcare setting, when and how to use restraints, the assessments that should be performed before, during, and after the usage of restraints, and the patient's rights in regards to using restraints. So to begin, restraints can be divided into two separate categories, mechanical and chemical restraints. Mechanical restraints are more commonly used partially to avoid any potential adverse effects of a chemical restraint. Both are used to ensure the safety of both the patients and the staff. They are to be used as the last resort method, as restraints can have a negative effect on a patient's mental or emotional well-being. Some various examples of mechanical restraints include the mitten restraint, the elbow restraint, the belt or body restraint, and the soft extremity restraint. In this video, Carly will talk about the various types of restraints.
There are a couple of different kinds of physical restraints. The first we have is a waist belt or a body belt that's used for confused patients who continuously try to get out of bed, posing a threat to the well-being after certain procedures, such as ankle surgery or hip replacement. The second would be an elbow restraint. This restraint makes it difficult to remove or disrupt a medical device near the face or neck. This would make it difficult for a patient who bends their arms. Third, which we will be demonstrating, is a soft extremity for patients who are agitated and cannot be redirected, specifically when they are removing their medical devices. These are used to immobilize all or one extremity. And lastly, there are mittens, which are used to prevent patients from removing medical devices, dressings, or scratching themselves.
So as Carly was talking about, here are some visuals of all of the various types of mechanical restraints. Up in the top left, you have the waist or the body belt restraint. These are typically used for a confused patient in order to keep them in bed after a surgery, like an ankle surgery or a hip replacement. You wouldn't want them getting out of bed and injuring the site of surgery afterwards. On the right, you'll see the shoulder or elbow restraint. This one is used in order to stop bending at the elbow. So if you have a patient with an IV in and you don't want them ripping it out or bending their elbow, that's the one you'd want to use. The mitten stops people from scratching or pulling as well. And then the soft extremity keeps all extremities tied to the bed. And that is the one we will be doing a demonstration on. So it's very important to remember that restraints are a last resort tool and are only to be used for the patient and or the staff's safety. Orders are required every time you use a restraint. Some examples of when to use a restraint include a patient who repeatedly rips out IVs, frequently attempts walking on an ankle that just underwent surgery, or is physically harmful to themselves or other staff. Often these patients are confused or have an altered mental status. A patient simply being verbally combative, misunderstanding provider orders, or occasionally disregarding orders is not enough to warrant the use of restraints. Okay, so this is a demonstration of a restraint use.
Verifying your birthday for me? Ava Peters, September 28th, 2000. Perfect. Do you know what time it is? I think it's maybe around midnight. Okay, okay. Do you know why you're here? I don't know. I had a surgery or something. I'm in a lot of pain. You're right. You did have surgery. You had hip replacement surgery. So I know you said you're in a lot of pain. How is she feeling today? Not too good. I want to get these things out. So what I did was I evaluated her A&O, and she got the time wrong, and she kind of got why she's here wrong. So she's not totally confused, but she is a little disoriented. She also noted that she was feeling like she's in a lot of pain and she really wants to take these out. So that's an unsafe behavior, and actually we'll go into it. She has been ripping the IVs out of her arm repeatedly, despite being educated and anytime she's not monitored. Okay, so Ava, I understand you're in a lot of pain. I'm so sorry about that. But we need to keep those IVs in your arm so we can continue your plan of care. When we rip them out, it can really hurt you. It can hurt staff with those exposed needles. So I have some doctor's orders to put restraints on your wrists. They're very comfortable. It's only going to be temporary, and it's just to keep you more safe. Is that okay? Yeah, that's okay. Okay, thank you.
Okay, and so this video is going to show Brandi coming in and actually putting on the restraints and what that process would look like.
Can you verify your name and birthday, please? Ava Peters, September 28th of 2000. Awesome. Are you feeling any better? Yeah, I guess. Okay. Well, I've got those restraints that the doctor ordered. Are you ready to put them on? Yeah. Awesome. So for the purpose of this video, we're going to pretend that I already did vitals. So she's healthy, stable. There's no safety reason physically or emotionally that we cannot put these restraints on. So we're going to be using the soft extremity restraint right here, and this is going to go right on her wrist. All right, Ava, this is our soft extremity restraint. I'm just going to put it on. Let me know if you feel uncomfortable in any way. All right, so there's at least 2 fingers room in here. So she should be okay circulation-wise. We're going to go down here and buckle it. There is a picture here demonstrating where to put the restraint. You cannot just put restraint hook on any old piece of the bed or on any post. They have to go specifically where the bed states it needs to be. All right, Ava, how does that feel? Good. All right, I put the call button next to you. Can you reach it? I can, yeah. Okay, so please feel free anytime you are uncomfortable or you need anything, press that call button and someone will be in here right away. We're going to check up on you every 15 minutes. So just let us know if you need anything, okay? Thank you. Awesome. Okay, we'll be back in a little bit. Thanks.
And this video will show Carly checking up on me as Brandi has delegated this to her because she is a fellow nurse.
On your restraint, how are you feeling? Pretty good. Beautiful. I'm going to do assessment on her skin, on her circulation, if she needs to use the restroom, and her breathing. All right. Let me check your circulation. Can I see your chest, please? Perfect. Look under the restraint. Yeah. Everything's looking good under here. How are you breathing? Are you feeling all right? Yeah. All right. You need to use the restroom? Not this moment. All right. So in Colorado, we have to give them a break every 2 hours, and at that time they use the restrooms. And we will also verify if they need to continue with the restraint.
So some key takeaways from those videos would be that restraint placement and following assessments cannot be delegated to CNA, certified nurse assistants, or MAs, medical assistants, or anyone who is not an authorized personnel, like a nurse. In the state of Colorado, restraints must be temporarily removed to allow for a break and for the patient to use the restroom. This must occur at least every 2 hours, and the break must be for a minimum of 10 minutes. Regulations for this do vary by state. Assessments following restraints include evaluations for skin integrity, respiratory and cardiac evaluations, circulation evaluations, and mental and emotional state. In the video, Carly used capillary refill to assess circulation to the hand. This must be completed every 15 minutes. Restraints require doctor's orders and are only to be used when all other options for patient safety have been exhausted. Some examples of alternatives to restraints would include providing companionship and supervision to the patient, such as a family member or a patient care assistant, a PCA, offering diversional activities like music, puzzles, activity aprons, even folding towels. Oftentimes people just want something to do, so giving them a task like that can really help. Assigning confused or disoriented patients to rooms near the nurse's station can help just so they're closer to people who can help if they're needed. Providing visual and auditory stimuli like picture books and tablets can keep them occupied. Removing cues that promote leaving the room, such as like an exit sign, you wouldn't want them to see that and follow it. Promoting relaxation techniques and normal sleeping patterns, instituting exercise and ambulation schedules as allowed by the patient's condition, attending frequently to the patient's needs for toileting, food and liquid, and pain management. Camouflaging intravenous lines with clothing can help because if they don't see the IV, then they won't know it's there oftentimes if they're confused. And making sure you evaluate all medication effects and ensure timely and effective pain management for the patient. And here are our references. Thank you guys so much for listening.